I'm Juliet Akelo. I'm the Chief of Field Office. I'm here in the warehouse in Sitwe in Rakhine, Myanmar. Rakhine is one of the states in Myanmar that's in the northwest part of the country, and it's one of the poorest. Over the past few years, we've been grappling with issues of armed conflict, natural disasters, and that has led to a number of displacements, internal displacements in Rakhine. UNICEF is providing services in very hard to reach areas, including in the displacement sites and camps that in the whole of Rakhine. We are also ensuring that we provide services in terms of water and sanitation and hygiene to ensure that the population, women and children, have clean drinking water, and also supplies where and containers they can use to store the water safely. And as you can imagine, the number of issues related to psychosocial support, not only for children but also for parents and families in the communities that we work in. And through our child protection programming, we're ensuring that children have access to mental health and psychosocial support in the child-friendly spaces, in communities, but also parents are better trained to support their children, but also address issues of the trauma they have been through. In terms of education, we know that the number of children who have dropped out of school, and also following COVID-19, most of them did not go back to school, and also there are different learning structures and mechanisms in Rakhine. So UNICEF and partners are trying to adapt to that to ensure that individual needs are addressed and find solutions to address those learning needs, so that there's a holistic approach to children's development in the provision of services. Despite the challenging working environment in Myanmar, we are increasing our investments in localization and working with the local partners to ensure that we continue to provide life-saving services to children and families in the communities in hard-to-reach areas in Myanmar. We also know that working with the local partners ensures that there's trust, and we're working with the people that they know and close to the communities that we serve. So we are committed to invest further into this and strengthen those capacities and working with the local communities in now, but also in the coming year. We are grateful for our donors for the support that they've provided to ensure that we continue to provide life-saving services to all the children, families and communities in Myanmar. Increased and flexible funding will ensure that we are nimble in our approaches and also dynamic in ensuring that we provide services given the ever-changing environment. And also looking at 2024, where the environment is projected to be more challenging, we will strengthen working with local partners and increasing localization to ensure that every child in Myanmar, wherever they are, is reached, and also populations and people in hard-to-reach areas are reached with the services that we are providing.